Hello and welcome to our training video on mastering client communication for intake coordinators. This training will equip you with the essential skills and etiquette needed to handle phone calls and emails professionally and compassionately. By the end of this training, you will learn how to apply phone and email etiquette standards, use effective communication techniques, including de-escalation tactics, collect and verify client information during a therapy intake call, and schedule the intake appointment in Theranest. There are two ways a potential client will reach out for an intake from us. The first is via phone, and the second is via our online form submission. First, we'll walk through how to manage a phone call, then we'll switch to managing the online portal and emails. The primary goal when answering calls is to help the caller. Even if we are not their ultimate provider of choice, we want to do our best to assist them. Keep in mind that callers may be in distress and may not always be kind. It's our job to remain professional, be kind, and be respectful at all times. We have a saying here at Paragon: treat everyone with the dignity and respect they deserve. Keep this in mind and take it to heart given the population we are serving. Great! Now that you know the basics, let's go over the phone script when someone calls. When answering the phone, say, "Thank you for calling Paragon Behavioral Health Services. How can I help you today?" Remember, our goal is to help. Next, you'll want to gather some information. You'll need their full name, date of birth, and insurance company name, and insurance member ID number. Here's what to say. May I please have your full name, date of birth, and insurance information? While you're on the call, verify the insurance information with them. Go to the website https://calculator.meetnirvana.com/. Once you're at the site where it says your information, put in the client's first and last name. In this box, fill in their date of birth. Next, enter in the therapist's NPI number, which can be found in our Outpatient Standard Operating Procedure Manual. Enter their insurance information, then click Calculate. You'll want to explain the insurance verification process. Here's what to say. We're taking a surface-level glance at your copay and deductible amounts. We'll get you squared away with an appointment, but between now and your appointment, we'll double-check the insurance verification and provide the most accurate information by the time of your visit. Inform the client what their copay or deductible amount is. Sometimes, deductibles can be difficult to verify upon first glance. Our billing team will take a closer look after the call to ensure we minimize surprise fees. To make an appointment, you'll first need to enter the client into Theranest. Now, check the clinician availability and ensure they are in network with the client's insurance company. This can be verified in Teams. Then, go ahead and enter the appointment into the calendar. This step is covered in detail in the scheduling and appointment video. Before you end the call, remind the client of our no-show and late cancellation policy. Here's what to say. I'd like to bring your attention to our no-show and late cancellation policy. We ask that you call within 24 hours of your appointment if you need to reschedule. Failure to do so may result in a $60 charge that is not covered by insurance. Of course, if there is a true emergency, the fee is waived. It is the clinician's responsibility to determine if the fee is appropriate. Sometimes we'll receive calls from a person who is in distress. Here are some typical signs a caller is in distress: raised voice or shouting, rapid speech or difficulty speaking, crying or emotional outbursts, silence or difficulty responding to questions, or expressions of frustration, anger, or hopelessness. Let's review how you can help the caller if you notice any one of these signs. When you recognize signs of distress, implement these de-escalation tactics. Remain calm. Keep your voice steady and composed. Your calmness can help to reassure the caller. Listen actively. Allow the caller to express themselves without interruption. Show that you are listening by using verbal nods like, "I understand," "I see," or "please go on." Show empathy and understanding. Acknowledge their feelings with phrases like, "I can hear that you're upset," or "It sounds like you're going through a tough time." Use a calm and reassuring tone. Speak slowly and gently to convey that you are there to help. Provide clear and concise information. Avoid jargon and keep your explanations simple and straightforward. Offer solutions and alternatives. If you can't provide exactly what they need, offer other ways to help, or alternative resources. That concludes the phone portion of this training. Let's switch gears now to discuss the online form and emailing potential clients. First, within 24 hours, email the client the script you'll find in Teams. Next, you'll go ahead verifying insurance prior to the call with the potential client. After you have all the information you'll need, call the client and follow the phone etiquette we discussed earlier in this video. In this training, you have learned how to apply proper phone and email etiquette, use de-escalation tactics to handle distressed callers, collect and verify client information during a therapy intake call, and schedule appointments and manage client records in Theranest. Thank you for participating in this training session. Remember, we are working in mental health, and it is crucial to always treat people with the dignity and respect they deserve. Your professionalism and compassion can make a significant difference in someone's life. Keep up the great work.